Hello, welcome. My name is Ian Thomson. I'm with Oxfam Canada, and I'd like to welcome you to our latest Oxfam Live webinar. Thanks so much for joining us today. I'll be the moderator for today's webinar. I'm a policy specialist on the policy team, and I focus on gender justice and extractive industries. And I did want to start off with a land acknowledgement to recognize the Indigenous traditional territory. I'm speaking to you from the unceded territory of the Algonquin Anishinaabe people. And given that this is a virtual event with people gathered from many territories, I'd invite you to please take a moment and acknowledge and express gratitude for whoever traditional territory you find yourself on today and are joining us from. We're very fortunate to be joined by an all Indigenous panel today of women from across Latin America. We'll begin with 3 short presentations by our 3 special guests, and then we will move to that Q&A session where we'll ask questions to the presenters based on the questions that we receive in the Q&A room. So let me begin by introducing our panelists, and we can get right on to the main content of today's presentations. I'll start with Melania. Melania is joining us from Peru. She will be the first of our presenters. Melania is a Quechua indigenous woman, and she's also the president of the National Organization of Andean and Amazonian Indigenous Women of Peru, ONAMIAP. ONAMIAP has been a partner of Oxfam for many years as we work in Peru on women's rights and Indigenous solidarity campaigns and policy change. Pleasure to have you here with us today, Melania. Our second presenter is Eva Tecún León from Tz'ununija Indigenous Women's Movement in Guatemala. Eva is a Maya Quiche woman from Chichicastenango, Guatemala, and she has been a member of the Minor Council of Tz'ununija Indigenous Women's Movement for a number of years. She's a political scientist by training and graduated from the University of San Carlos in Guatemala. She's also very active in the student movement and was a founding member of the Maya Student Movement for University Reform. Pleasure to have you here with us today, Eva. Our third presenter is an Oxfam colleague of mine, Elisa Canqui. She is a program manager in Oxfam's Latin America and Caribbean regional program. An Aymara indigenous woman from Bolivia, Elisa joined Oxfam in 2019 after working for 8 years at IBIS Denmark, which is now Oxfam IBIS and has joined the Oxfam Confederation. She is a past member of the UN Permanent Forum on Indigenous Issues and has served as a consultant for a number of international organizations, including the Inter-American Development Bank, UN Habitat, and the Danish Cooperation Agency. We're really pleased to have all 3 of you joining us today. I think at this stage, we'll move straight into the first presentation. I'd invite you, if you haven't done it yet and you would like to use the interpretation service, to please turn on the channel if you require interpretation from Spanish to English, as all 3 of our presenters will be presenting in Spanish today. With that, I'll turn the floor over to Melania. Please go ahead.
Bien, alin causa y cachun la palayquichita, chailao piliu taricosconata, ari, bueno, un gusto,
Ian. It's a pleasure, Ian. It's wonderful to meet virtually in this way, and I would extend my greetings to everyone who's listening in and participating, all of the panelists and all of the other participants on this webinar. I'm from the Quechua people in Peru, from the, as already been said, the National Organization of Andean and Amazonian Indigenous Women of Peru. I would like to perhaps speak and say, speak from the point of view of what this crisis, this pandemic has meant for us as Indigenous women, and how we in the communities have begun to react to this crisis. At the beginning, with the quarantine in Peru, the communities closed their territorial borders so that no one could enter and no one could leave. However, we have seen that governments at various levels had not sufficiently strengthened their public policies, their public health policies for our communities. They've really been absent on the ground. And so the pandemic, and in the context of the pandemic, we've seen these huge gaps. And as a consequence, the communities have had to isolate themselves because there are no hospitals, there are no clinics, there are no health centers. So during the pandemic, the communities have been left to their own devices, have had no access to basic services like health centers and hospitals. So that's the first thing I want to say, and that we've noticed during this pandemic. And this has been a really problematic reality in all of the communities. We've seen total abandonment, total absence of the state, of the government. And as well, in this abandonment, in this absence of the state, indigenous peoples then have had to and have begun to revalue their own traditional ancestral medicines and treatments. The use of all of the medicinal plants that have been used for centuries, all of this ancestral knowledge has been revitalized and resuscitated. And this is a positive thing, you know. Yes, we haven't had access to hospitals and to health centers and clinics, but we have our traditional medicines, our traditional shamans and medicine men and women. And we have revalued these techniques and these plants and these medicines. And this has been very important for us. However, from the point of view of our national organization, we have continued to demand of the government that they implement public health for all, that it be strengthened, healthcare, but that it be truly intercultural. In Peru, there was prior consultation on intercultural health. That groundwork had been done. In the last 2 months, the government started to release some orientation, some guidelines, and some policies in terms of translation into original and indigenous languages, prevention of COVID-19, and they've also slowly been trying to put out fires left and right, as firefighters do, and addressing health needs in a very piecemeal manner. But really, we can say that the country needs to see a strengthening of public health with professionals, healthcare professionals, techniques, medicines. Less than 3% of the GDP in Peru is dedicated to health, less than 3%. And so we have said very clearly that not less than 6% of our GDP, of our national budget, should go towards strengthening public health and public health care. And to implement this approach that is an intercultural approach to health. As I said, this consultation took place, and we need to see it now implemented. We've seen that the extractive activities in the country have not stopped. They have not been paralyzed. There has been no quarantine for them. They have continued to work in the extractive sector, in the mining sector and petroleum sector, natural gas and so on, and have been, as a consequence, bringing the contagion to the communities, because most of the extractive activities in Peru are developed in indigenous territories, on indigenous land, in indigenous communities. And when there have been complaints about this, there has been repression. In fact, there have been deaths, like the case of Loreto. So this is another very important topic that the government has really ignored, has not made a priority.
Asimismo, tenemos también el peligro de la
consulta. Also the danger of virtual consultations and what they mean. The government has used that language of virtual consultations, and they said, yes, we'll do this. And then they said, no, we won't. Even though we have been demanding all along, and we've seen the documents the government has sent us, the documents clearly say the government is willing to engage in meaningful consultation with communities, but we haven't seen this actually happening on the ground. So that's where our concern comes from. Most of the communities don't have access to the technology to carry out virtual consultations. There's often no electricity, no access to Wi-Fi or reliable internet in these communities. So this is not a reality. So that's why we've continued to demand meaningful consultations on the ground, and that they not be done virtually, because this is frankly not accessible to communities. So I think I've gone beyond my 5 minutes, but thank you very much for the time.
Thank you, Melania. I appreciate it's difficult to share this in 5 minutes, and we will come back to you later. Let me turn it over to Eva now to share the experience of Indigenous peoples confronting this pandemic in Guatemala. Eva?
Buenos días.
Good morning. Hello to everyone. In terms of the situation in Guatemala, I think that there are many similarities with Peru. There have been a number of prevention measures adopted. Not all of them have been effective, and not all of them have really dealt in a meaningful way with the physical and mental health of the people. The government of Guatemala, within the context of the pandemic, has developed a number of prevention policies to foster the use of masks, social and physical distancing, but there have not been true strategies that strengthen health in the long term, and public health in particular. And this, of course, is a big concern for all of us. Beyond that, the measures that have been undertaken by the government are very general and not specific to the needs of various communities. Of course, there are exceptions given to large corporations. Policies are adopted by the government, but then there are exceptions given to these companies. And this means that there's inequality. There's not really equity, and there's not a respect for human rights, particularly the human rights of workers working for these companies. When these companies are not following the basic health guidelines to respond to the pandemic, when they're given exceptions, this places the workers in danger. Another important point is that the sources of information that come from the state, that come from the Guatemalan government, always have reservations, always have caveats and asterisks. They don't represent the reality on the ground, the stats and data coming from small indigenous communities, and all of the measures have not been put in place following consultation, meaningful consultation with the communities. Often they've just been imposed without any consultation or consent. And this is very important because in the first few months, when we started to coordinate and try to work with the measures that had been announced, we realized that these measures are not respectful of the cultural context of the indigenous communities and the indigenous peoples in Guatemala. Women in many places, don't have access to drinking water. The water only arrives every 3 days, and there are defined schedules for the arrival of this water. Often it's in the afternoon afternoon or in the evening, and there's no, sewage systems or proper plumbing, piping that brings in water to the communities. And this has meant that many communities were not able to stock up enough water during the pandemic. And of course, we all know that water is essential to life and is essential to the prevention of COVID. Having access to clean water is essential. Another issue that we're very concerned about is the fact that there's no plan, uh, and there's a lot of politicization and polarization around uh, various policies. You know, for example, when it comes to uh, electrical subsidies, allowing poor families to access a subsidy for hydro and so on. Um, these the most marginalized communities don't have any access to electrical power, so of course, they wouldn't have a receipt or a formal document which would give them access to then the subsidies from the government, which requires this paperwork. So there are these basic kind of oversight, lack of understanding of the situation on the ground, and then there's not a proper breakdown of statistics and data showing, how indigenous communities in different regions, in different parts of the country, in different cultural areas are affected by COVID. Prevention campaigns have not been carried out in the local indigenous languages. A lot of the public education has been done over social media. And of course, many indigenous communities, many individuals don't have access to internet, don't have access to social media like Facebook or Twitter, where the government is releasing its information on prevention and so on. So these messages often don't get down to the communities. The institutional measures then are not culturally respectful, are not being communicated in indigenous languages, and this is, you know, really troublesome and creates a lot of obstacles and barriers when basic information is not understandable. Information around curfews, for example, do not respect the realities of people in their communities. People who live in the countryside in small rural communities have to leave their homes at different hours of the night and day to deal with their basic needs. For example, if people are using latrines or outhouses, they have to leave their home to use those public facilities, and sometimes that's in the middle of the night, during a curfew time. So going to see animals and feed and tend to beasts of burden and other livestock. That has to happen at all hours of the day. And so if when there are curfews implemented just with a broad brushstroke from 5 in the evening till the next morning, this has a really deleterious negative effect on the way that rural communities and farmers function. Uh, Also, the economy in terms of subsistence agriculture and basic food needs of families from day to day. People have been left in total precarity during COVID. Many are now unemployed, have lost their work, any kind of remunerated work. And so poverty has been greatly increased during this period. As well, we've seen uh, um, some communities go back to working the land, go back to subsistence agriculture because they've lost other work in larger centers, and also just to feed themselves, they've needed to return to the cultivation of basic crops during this pandemic. As well, organizations throughout Guatemala, particularly the national indigenous organizations, have, realize that the big extractive corporations have continued to work. There's been no break for them. They have not stopped or self-isolated or been in quarantine. Their work has continued, and in many ways they've taken advantage of. They've been very sly in taking advantage of this crisis and continue their extractive activities with no scruples. And the Guatemalan state, the Guatemalan government has used legal and juridical mechanisms to allow for, you know, uh, to to facilitate, in fact, the work of these extractive companies. You know, using states of emergency and other mechanisms to give exceptions and actually give special rights to the companies during this pandemic. So not only are they not respecting, the basic public health policies around quarantining and so on, but they've also been given special rights by the government. The government has also used special they've also implemented policies to displaced communities, to actually move communities off their land during the pandemic, claiming that it was for public health reasons, but actually it was to give the land, to clear the land for the use of an extractive company. We've seen that happening as well. And that's where we have tried to state very clearly that the lives and the rights of indigenous peoples in Guatemala are clearly not valued, have no importance for the government, and have no value. And what we're seeing is a deepening during the pandemic of corruption. This is another real problem. Within the Guatemalan government, there have been issues with corruption for many years, but we're seeing a deepening of this corruption, a broadening of this corruption, and politicians and others taking advantage of this pandemic, of this crisis, to actually engage in even more corruption. Eva seems to be frozen. All right, here we go. A number of budgets have been approved, for example, to respond to COVID, and then this money seems to disappear. We don't see it actually spent on the ground. So we're very concerned about this corruption. And during this emergency, where if anything, the health system should be strengthened, there should be more resources spent on the health system. In fact, what we're seeing are these budgets are siphoned off and used for the army to purchase new weapons and new military systems, and not going to healthcare as the government is claiming. I'm not sure how much time I have left. Perhaps someone could indicate that to me, because I have not been looking at the clock. Can someone let me know whether I've
1 minute.
whether I've arrived at the end?
Muy bien. Muy bien.
Perfect.
En el caso de donde digo...
In terms of what I was saying about actions that have been taken by our organizations to try to combat environmental degradation, attacks on indigenous rights during this pandemic. Many people have denounced the raping of the land, incredible deforestation that we've seen by companies, with total impunity. We're very concerned about this. In the Quiché, for example, which is a department, in Totonicapán, before the pandemic, there was already a lot of work being done to denounce this tremendous deforestation, cutting down of trees. But now, during this period of confinement and quarantine, it's been exacerbated. There's more deforestation taking place because they know that people are in their homes and can't witness it, can't see it happening. There are also issues around education. Even though there's been an attempt to provide public education on television or through virtual means, most of the indigenous communities don't have access to electricity, let alone internet or Wi-Fi to be able to do virtual education. So the kids have been left without any education at all. And this puts us at a total disadvantage as increasing inequalities, educational inequalities between indigenous children and other children in the country, and shows how this system, this colonial system that we're still living under, is operationalized. And even though we carry out actions, affirmative actions, to try to encourage our kids, by creating our own scholarships, we see that the state puts in place obstacles and disadvantages our children. And I think I will end there. I know we can continue, but there will be a question and answer period, so I'll continue at that point. Thank you.
Great. Thank you, Eva, for that disturbing presentation of the impacts that are being experienced. It's very troubling to hear those effects of the pandemic and the exacerbating what are already, challenges facing Indigenous peoples in Guatemala, but just making it much, much worse and more difficult now. Before I turn over to Elisa, our final presenter, I'll just remind people, please feel free to put questions into the question and answer room. We'll come to the question and answer room following Elisa's presentation. I don't believe we have any questions at the moment, so please don't be shy. We want to make the most of our time together with these excellent people. So please, I'll turn it over now to Elisa.
Elisa seems to be on mute. If someone can tell her that she's on mute.
Elisa? There.
Can you hear me now? Great. Hello. Thank you for this opportunity to share in a different kind of space, and specifically to share the report by Oxfam on avoiding ethnocide, Indigenous people, and territorial rights in the context of the COVID-19 crisis in Latin America. There are a number of reasons why Oxfam made the decision to develop this report and to add our voice to the international concerns and to accompany our partners in the process, in their processes of advocacy. At Oxfam, we have continually warned about the social gaps that have been ignored for many decades and that are becoming actually wider in the context of the pandemic. Far from hospitals and medical attention, Indigenous people in Latin America are faced with a pandemic in conditions of social exclusion, racism, and discrimination, which is putting in great relief, dramatic relief, the historical inequalities that have existed all along. In all of the countries of the region, there are Indigenous communities at high risk, mostly because there's been total abandonment and absence of the state and an absence of services for integral healthcare and that are socially and culturally appropriate to these Indigenous peoples. For Indigenous women who have suffered a triple discrimination because they are women, because they are Indigenous, and because they are poor, the responsibilities and duties of care have become even more costly and have exposed these women to even greater risk of contagion. For adults, for senior citizens, a population already at high risk and where rates of mortality from COVID-19 are disproportionately higher, this situation has meant not only loss of lives, loss of these seniors because they've died from COVID, but also a loss of their traditional knowledge, of their language knowledge, of their cultural knowledge, and as important figures of authority and leadership within their communities. Indigenous communities are not only facing conditions of inequality because of the pandemic, but historical pressure on their territories and lands and their ways of life has continued. despite or in even though there have been exceptional measures put in place to try to protect against the pandemic, the extractive sector has continued to work because they've been considered to be a strategic economic sector by governments. Some companies have even, and some governments have even taken advantage of the crisis to diminish environmental regulation and to set aside prior and informed consent. This has been the case in Peru, and the UN rapporteur has underlined this. Mining companies and petroleum companies must urgently implement measures to protect health and to protect their workers and neighboring communities. The pandemic has not interrupted invasion of indigenous lands or stealing of these lands. It is not reduced violence by the state or by companies. On the contrary, illegal armed groups have been more rampant than ever. A very clear example is the case of Colombia, where we have seen a rise in violence and taking over of land, an increase in forced displacement of communities, and particularly indigenous communities, and an increase in the assassination of leaders, both male and female leaders, who have also seen the measures to protect them disappear, or at least been seriously weakened. We know that Latin America is the continent, is the region in the world where human rights defenders are most threatened. Social organizations, social movements, and indigenous movements have been affected by increased militarization of their territories. And this is seen in all of the various reports that have been released internationally. Indigenous organizations then have continued to denounce this violence, criminalization of their activism, the presence and militarization of armed forces and police forces being used to repress and even kill indigenous leaders. Therefore, I would like to really underline the recommendations to the governments of Latin America that we have made in our report. And these respond specifically to the crisis that we find ourselves in because of COVID. These are really important recommendations in the Oxfam report, and we need to highlight them today. One is to respect and support when it is specifically when it is asked for the sanitary and health buffers and measures to allow for self-protection by and for indigenous peoples to avoid the propagation of the virus in their communities and rural villages, to suspend immediately all activity that promotes and allows for the entrance of foreign persons into indigenous communities, as well as mining activity and development, deforestation, petroleum extraction and exploration, agricultural industry, wide-scale livestock, and religious and evangelical proselytizing. Three, to apply and to implement a moratorium on all extractive activity in the interior and around and neighboring indigenous territories to prevent the spread of the pandemic. There is a high risk of the violation of indigenous rights, and there is less and less effective consultation and prior consent in this context. For assure an end to the violence directed towards and the criminalization and persecution of indigenous communities and their leaders. Strengthen policies that stimulate small agriculture, family agriculture, and protect local economies that allow for food safety. Increase public investment destined to support small-scale indigenous producers, strengthen policies that recognize the territorial rights, collective territorial rights of indigenous people, guarantee that economic relaunch activities and projects respect indigenous rights and involve prior and informed consent, as well as international standards in the area of social and environmental rights, and promote reforms, political and economic reforms that allow for control and development of lands and natural resources by local people, by indigenous people, in line with Buen Vivir and other indigenous principles. So we need to, all of us, support these recommendations so that we can contribute to the overall struggle that indigenous people are involved in on their lands and in their territories as we speak in the context of this pandemic. Thank you very much.
Thank you very much, Elisa. There is a lot in that report, and it's nice to have it summed up so succinctly and to have it so well received, I think, within the region to date. I'd like to turn now to our interactive question and answer session. Thank you. I see some of our participants have already been posting questions into the question and answer room. And I will start with the first two questions. And the first question, I believe, is directed both to Melania and Eva. The question is, how has the impact of COVID changed your working strategies, both with respect to work with communities and with respect to strategies with your governments? The second question is directed more towards Melania. You referred to the challenges with virtual consultation processes. And the question is, has the government tried to consult indigenous communities in person during the pandemic? So I think we'll start with the broader question on how you may have changed your work strategies with respect to community and with respect to governments first. Who would like to begin, Eva or Melania?
Bien.
Okay, Melania.
Melania, adelante. So, in terms of the first question on impacts, one of the things we have been able to do as an organization of indigenous women, our work, it takes place really on the ground, in the communities, face to face, in person. This work is done, of course, in person, face to face. And so the pandemic has had a huge impact on this, knowing, of course, that the communities don't have access to the various technological platforms, and it's not really part of their functioning anyway as communities. So even from a cultural point of view, so all of this has complicated our work. This whole move to do everything virtually during the pandemic does not reflect real life, does not reflect the reality and the way dialogue and debate and discussion takes place in these communities. And for us as indigenous women, it's been a huge challenge. It's created huge difficulties. When we talk also about consultation with the government, yes, there has been the intention. The government first announced we are going to do virtual consultations with indigenous communities. The finance minister himself said this. And so we started to consult with other organizations within civil society, and we saw sort of a step back from that approach, which doesn't mean it's going to happen. We've seen documents from the culture minister, from the culture ministry, and from the finance and economy ministry. They're still talking about virtual consultations. And they've said that if the communities want to participate, then we are open to dialoguing with them. So some communities are already involved in these consultations. But that is our concern as an organization. It's only some communities, and only communities where there is access to some technology and platforms that allow for this kind of consultation. In terms of the strategies for our work and how they've changed, yes, definitely. With regards to the pandemic, this was not something we saw coming, and it has meant that all of our actions as a indigenous women's movement in Guatemala, all the actions we carry out have had to be modified, have had to change. Our strategies have had to change. We've had to pivot because all of our actions, of course, before the pandemic, and all of our activities were carried out in a very inclusive community way, in person, face to face, assemblies, gatherings, workshops, and so on. We can't do that face to face anymore. So it's important to mention that in the case of actions carried out by women's indigenous organizations that form part of our that are part of our movement and who are active on the ground in the communities, they've decided to establish specifically processes with women in groups of 5, which allows for sufficient distancing and protecting of individuals and communities, sometimes even groups of 2, 3, 5, so that we're not losing the in-person dynamic, which is the way we've always organized, the way we've always analyzed, the way we've always dialogued. But we've had to adapt that as indigenous women, particularly the work around violence and combating and diminishing, reducing violence, because the indices of violence, we've seen them skyrocket, particularly violence towards girls and women. We don't see any response from the state, from the government, the Guatemalan government in this regard. They have released a hotline that women can call if they are victims of domestic violence or other kinds of violence, but there's no one to answer at that hotline in their language, in their indigenous language, so it's useless to them. The various human rights defenders who have constantly been accompanying these communities have seen real challenges in their work in providing counseling and assistance to these communities. So all of this work then has been affected, and we're doing more and more of it on a small scale, meaning in smaller groups, 2 or 3, 4, 5 people at a time. And we are having to even write reports differently, disseminate and share our reports with the UN and other international agencies in different ways, communicate the findings of these reports to our own government in creative and new ways. Of course, this whole virtual world we live in now provides very little comfort to indigenous women in rural communities who don't have access to these platforms. So we've opted often to use the phone and other older technologies that are more accessible to more indigenous women. The fact that there's no electricity, often there's no cell system, no signal, sorry, or no Wi-Fi or internet in communities This has been a huge obstacle, but it's a reality we have to deal with.
Thank
Me
you both.
gustaría ahí como complementar.
I would like to add to what my colleagues have said. I think we've had to rethink at all levels and be very creative, both at the level of Indigenous communities working on the ground in the Indigenous territories, in the communities, how to face this new reality, both for the communities, but also for partners, international development agencies, and so on. The whole landscape has shifted and changed. In some ways, Indigenous organizations have been strengthened because they've been forced to stand on their own 2 feet and find innovative answers, particularly in face of a total absence of the state on the ground, and no services, and the invisibilizing the fact that the national data being collected does not reflect realities in certain regions. For example, in the Amazon, we are working a lot with organizations. There's been a global campaign of Indigenous groups in the Amazon, which is allowing these communities to receive food, to receive basic health services. So even though over the last 2 or 3 months, we've all been learning, we've all been on a steep learning curve, how can we respond to this crisis? And I think women as well, Indigenous women, have really mobilized, have organized in their own networks, in their own ways of doing things, and have continued with this initial plan of, making their voices heard and not being marginalized in the context of the pandemic, still being active in the national discussion.
Great. Thank you for adding that, Elisa.
Muchas gracias, Elisa.
I think we have time for a couple of more questions. I see there's a question that has come in that picks up a little on what Eva and Elisa were just talking about. Eva mentioned human rights defenders accompanying communities and some of the added risks that they're facing currently under the pandemic. And Elisa was talking about how international organizations have been ramping up to respond to the crisis. The question here for our presenters is, are there internationally supported observers on the ground who can provide protection and advocacy support for Indigenous peoples? And how can organizations outside of these countries help to increase the number of observers and reporters? So that was one question. The other one that I wanted to bring to our panelists was regarding the race for a vaccine to COVID. We have a question that starts off, we see that countries in the north are racing to develop COVID-19 vaccines and are reserving doses for their own citizens. There seems to be few efforts to ensure that vaccines are available for free for all, particularly the most vulnerable, such as Indigenous peoples. What are your thoughts regarding this situation? So I would invite any of our panelists to respond either to the first question on international observers and reporters accompanying Indigenous peoples, or the second question on vaccine access for Indigenous peoples. Maybe I will turn to Eva first this time. Eva, if you would like to respond to these questions, please be my guest.
Muchas gracias. Sí, en cuanto,
thank you very much. In terms of international observers or international organizations who do this work of observing and reporting on the ground, we have been coordinating with them. They also have been trying to be as respectful of course, the health measures being adopted both by communities and by the national government. We're seeing the government in Guatemala, for example, using curfews, states of siege, states of emergency for purposes not only related to the health crisis. And in that context, international organizations have played a crucial role in terms of follow up, in terms of spreading the message around the world of what is going on the ground. They've been able to release, for example, alerts on what is happening in individual communities. And we, as a movement, but also other partner organizations, uh, we've been trying to see how this information can be most effectively used to mobilize resources internationally and also to raise awareness internationally. In the case of indigenous territories and lands that are being sacked, taken advantage of, in the context of COVID, the use of states of emergency, states of siege, curfews, and so on to reduce movement rights, for example, for indigenous communities, and then allow extractive communities, extractive companies to come in and do whatever they want. There have been hearings held with inviting the testimony of human rights defenders and trying to make their voices heard in alternative media and uh, allowing for the amplification of these voices through our international partners. In the case of observers, international observers, I think that the role has more been to spread the message, to broadcast our voices internationally. In the context of the government we have in power right now in Guatemala, which is a government that does not want to dialogue, it is a very conservative right-wing government, and so this limits that part because we see them criminalizing any action taken to get out the truth. Do I have time to answer the second question? Or are we getting to the end?
I think we'll have to turn it over to Melania now. I'm sorry.
Bien, solamente yo para decir...
Yes, I just wanted to add, in terms of rendering visible the problems that we've seen in indigenous communities, our networks have been very important and very effective, actually, in many ways. And we've seen, alliance building and strengthening, and partnerships with a number of international organizations, even with the CDH and other instances, movements of indigenous women and national organizations of indigenous women in other countries. We've been able to share our experiences, compare notes, and this has been very important, particularly during the pandemic, because we've been able to render visible what's going on. Also using, as my colleague has just said, using alternative media, not the major mass media in our countries that tend to be very conservative and do not reflect the struggles for collective rights of indigenous women. But we've been able to at least get some of our points of view out using alternative media. We've had multi-sectoral networks that have allowed us to amplify our voices. And the work that we've seen between organizations, between civil society, international development and cooperation organizations, and alternative media internationally, this is very helpful because in some way we've rendered visible the work that's being done, the struggle that's taking place. However, the criminalization that we're seeing is continuing because there has been repression on the land, in the territories, as a response to the strategic work that our activists are doing and human rights defenders are doing. We've seen the reaction to that is increased repression. Thank you very much. I just wanted to add several points very briefly. What's been said. I think that the virtualization of all of this work, although it's been limiting for some indigenous communities, on the other hand, this amplifying of the virtual space has allowed indigenous voices to be heard in corners of the world and in uh, in in global and international processes that before has not been possible. So there is also a positive side to the use of these virtual tools that has facilitated, the creation of spaces where indigenous voices can be heard more widely, more has facilitated more participation of indigenous leaders in these global spaces, in these global fora. Uh, on on another side, these tools have long been important to advocacy work, but virtual tools have allowed a greater number of people, and specifically in our case, women and young people and young women. There was kind of a privileged class who had access to these tools in the past, and now there's a greater number of people, a greater number of activists, a greater number of voices, including a lot of women and a greater number of young people to participate in these kinds of webinars, for example, and to inform people around the world about the processes that are taking place on the ground in their communities. And I think that going forward, this will continue and can be a very positive change that comes out of COVID-19. It is a tool, then, these virtual tools are important to the protection of rights and the implementation of measures to protect rights on the ground. Thank you very much.
Great, thank you for that, Elisa. I believe that brings us to the end of our time together. But you're right that these virtual settings, which we are all confined to, do open up the possibility for new relationships and communication in new ways. So let me start off by our closing by thanking all three of our special guests and presenters. It was wonderful to meet you today. It was wonderful for Oxfam Canada and our supporters across the country to hear your messages. And our commitment is to stand in solidarity, to share these messages with more and more Canadians so that the situation that Indigenous women are experiencing in the Americas is something that Canadians are aware of, and to find ways that we can take action in solidarity with you. Thank you so much for spending time with us today. I'd also like to thank our interpreter, our tireless interpreter, Michael Cardy, who was able to make this exchange happen back and forth in both languages. Thank you, Michael. And also to my colleagues, Ellie and Bukola, on the tech side, who made everything happen so smoothly today. And especially to all of you who joined us. Thank you for participating in today's Oxfam Live, and I hope you'll tune in to future Oxfam Lives. Please visit the Oxfam Canada website to learn more about how you can find out what's coming up next on our agenda. So with that, good day and solidarity to you all. Thank you.